Good evening, everyone, and welcome to today's wonderful evening with Dr. Murali Bharadwaz. Very little time, not even 10 days. We are ahead of the NEET PG 2024. Very nice to see Mohan Pawar. Yeah. Mohan Pawar, Kuldeep, Joshua, Arun Chowdhury, and many more who are all online. Our spring sessions are becoming very popular, very useful. Thanks for all the feedback. Because in the last moment, what is important? There are 10,000 PYQs from 2013 to 2023. 10 years of question papers. Once upon a time in 2013, 2014, 2015, 2016, there are about 1,500 to 2,000 questions that have been released in the NEET PG exam when it was started in the early days. So once we analyze these 10,000 questions, we know what examiners want from us. But what's the problem? Every time we think tomorrow is a better day, let me read a lot and then start the revision. That great day rarely comes. You should start now. So what I did was, the options are irrelevant. Every MCQ is converted into a single liner and the topic is being appended. And voice not coming? Can the online students can please Sham, voice is there, Sham. Can the online students can punch as a voice loud and clear? Sony and many more who are all online. Audible, Sindhu, thank you. Sorry, it is coming. Very good. Thank you. Thank you. Sham, please check your speakers in the phone or in the earphones. No worries. So once upon a time, we all used to love to have about 800 students, 1,000 students sitting in galleries. But today we are all shrunken into online classrooms, right? So if you keep punching some comments, then this looks more like a face-to-face class. So let's make the great beginning, doctor. And the whole purpose is, every MCQ is converted into a single liner along with the topic to which it belongs, and every ebook, sprint 7, sprint 8, sprint 9, up to sprint 16, these 10,000 questions are being converted into single liners and the topics are there with you. It's up to you. Those topics where you are feeling little weak, unfinished, just go back and do the revision quickly, because it was asked in the entrance exam, right? So that's how you need to do a rapid revision with this sprint 7 to sprint 16 ebook PDFs. So please go to the learnograph.com. You have the link below, and there you can be able to download by just paying $300 for each of these ebook PDFs. So shuru kare aaj ki revision mela and bhajan, right? Very rapidly. So once you come to the ebook, you have the cover and then the content will begin. So which year it is asked and what is the topic and what is the fact that has been asked, has been created. 1,000 facts from 1,000 MCQs year-wise is being organized in the sprint ebooks. Can the online students can punch? Is the size is okay for all of you, doctor? Can you please punch? Is the size? Sham is asking any material for FMGE. Once 2023, 2024 NEET PG is over on, from the next day, we will do the sprints on the FMGE question bank of the past 10 years. All right, doc. So in fact, FMGE, we can do the past 15 years. Yes. Sir, it is small. Okay. We'll try to make it a little bigger. Is it fine now? Is it fine now? Sony and everybody, can you please punch? Is the font size is big enough? So please go to the learnograph.com and download so that it looks better. All right. So let's make the great beginning, doctor. Very good. Just now, around 15 students have downloaded the ebook PDF by paying 300 rupees for each. Good? Yes. Now, doctor. PICA, posterior inferior cerebellar artery. You should know the two vertebral arteries combine to form a basilar artery, and basilar artery divides into posterior cerebral artery. So, from these vertebral arteries and basilar artery arise the ICA and PICA. So, the ICA and PICA basically supply the brainstem. So, what is brainstem? You have midbrain, pons, and medulla. So, this basilar artery forms a vascular tree behind this brainstem and supplies it. So, any occlusion of the posterior inferior cerebellar artery will lead to infarction in the lateral part of the medulla, leading to lateral medullary syndrome of Wellenberg is what you should remember. So, superior mesenteric artery was given, angiography of that. Superior mesenteric artery occlusion is very important cause for mesenteric vascular ischemia. So, what is the classical feature in mesenteric vascular ischemia, doctor? Abdominal angina, it is called. Toda khana khaye to. There is a more demand for blood supply to the gut, but the mesenteric ischemia, if it is there, there is no blood supply, and increase of the blood supply is not there, and that leads to severe abdominal pain. That's the reason the people are afraid to eat food. The moment they eat food with superior mesenteric artery occlusion, they get a pain in the abdomen, which is very classical feature. Abdominal angina is the sign par excellence, clinical sign par excellence of superior mesenteric artery occlusion. Now, Weber's syndrome, North-Nagel syndrome, Parinot syndrome, all these things, Benedict syndrome, all these brainstem syndromes you should know, doctor. So, in Weber, the midbrain cerebral peduncles are involved, and that is the reason it leads to midbrain. Mein what cranial nuclei you have? Oculomotor and trochlear. Please remember, third, fourth cranial nerve nuclei are there in midbrain. Fifth, sixth, seventh, pons, abducens, and facial is there in. Fifth trigeminal, sixth abducens, seventh is facial. These three nuclei are there in the pons. Everything else is there in the medulla. So Weber involves the midbrain cerebral peduncle. So that is the reason there is a oculomotor nerve palsy. At the same time, the descending pyramidal tract has not yet decussated. Pyramidal tract, corticospinal tract is not yet decussated. That's the reason, if at all there is a right cerebral peduncle involved, ultimately that right corticospinal tract will go to left side of the body. That's the reason there is a ipsilateral oculomotor palsy, contralateral hemiplegia. That is called Weber syndrome because of the midbrain's involvement is what you need to remember. Indole acetic acid is in the urine is present in carcinoid. So everything you should know about the carcinoid. Chordoma, from where does it arise? Notochord. Mullerian inhibiting factor will make Mullerian system to get destroyed. Mullerian system is responsible for all the female genitalia to get produced. So in a male, because of the Y chromosome, which is responsible for Mullerian inhibiting factor, the Mullerian agenesis occur, and the men do not have the woman's internal genital organs because of the courtesy of Y chromosome is what you need to remember. Now once more, if you are feeling little tweaky about it, make a note. भाई मैं जरा स्पर्मेटोजेनेसिस पढ़ना है, male and female genital development. Similarly, Rokitansky-Kushner-Hostner syndrome, which is the Mullerian agenesis, पढ़ना है बोल के एक quick list बना लेना, or you need to go back and do the revision in whatever the study material, whichever coaching study material that you are already following. That should be your approach. So please at least go once through these 10,000 single liners. What topics are there in the examiner's mind? Automatically, आप each expert बन जाओगे. You will become the guru to push your classmates if you know what is frequently tested. So very nice to see Prakash, Bhaduriya, Madhu, Soni, Sindhu, Kuldeep, Sham. One day you will all become bade banke mal banoge. You will all become top neurosurgeons, cardiologists, nephrologists, and that day I'll be the proud, happiest teacher who will say, oh my God, Dr. Sindhu, the gynecology or obstetrics, Dr. Madhu, who is a neurologist, Dr. Prakash, orthopedic surgeon, he was in my class, man, in the last moment before exam. So, आप काम करेंगे, आप मेहनत करोगे, आपका top rank बनने का credit हम लेंगे, right, doctor? So that should be the spirit in the last moment of exam. Chromosome 19 typically is involved in myotonic dystrophy. The nerves are derived from the neural crest, nerves of the brachial arch. Ureteric bud develops into mesonephros. Once more, you can see 2018 NEET PG. कितना खास टॉपिक है genito-urinary embryology. In every exam they will ask the question, right? So very nice to see 20 online classmates. Please don't forget to like this video, share this video to all your friends, tell them about the sprint ebooks. Please also populate about learnograph.com and ask your friends to download the ebook PDFs and do the revision of this 10,000 question bank. Greater Omentum, it develops from dorsal mesentery, not ventral mesentery. And in pregnancy, puerperium, it is the femoral nerve which is most commonly compressed. So where do you see salt and pepper appearance, doctor, in the skull? Hyperparathyroidism. Today only go to the Google images. Look at how salt and pepper pot appearance of skull looks like. It will be a good image-based question. So where do you get P. pulmonale, doctor? P. pulmonale. Very good. Just now, about a group of 15 students have purchased the Sprint 8 ebook downloading from the Learnograph. And just now, one of them WhatsApped me saying, what a wonderful way that we can finish our last moment preparation. Thank you so much, Dr. Vikas, for the feedback. Now, P. pulmonale typically occur whenever there is any pulmonary hypertension, whenever that leads to right ventricular, right atrial enlargement, then that reflects as a tall P waves, P. pulmonale. But there is an entity called pseudo P. pulmonale. Even though there is no right atrial enlargement, though there is no right ventricular hypertrophy, or though there is no pulmonary hypertension, still the P waves are very prominent. Vertically, they are very tall. That's called pseudo P. pulmonale occurring. Hypokalemia is what you need to remember. Once more, you need to go back to the Google images, the ECGs, and look how P. pulmonale look like, P. mitral look like. P. mitral occur whenever there is a McDonald M-shaped P wave that occur when left atrium, right atrium, both of them are equally getting contributing to the P wave. Then you get a M-shaped like McDonald's M-shaped P wave, which is called P mitral. It occurs when left atrial enlargement is there in the case of the mitral stenosis, is what you need to remember. So, doctor, in the learnograph.com, we also uploaded 50 full-scale grand test ebook PDFs. Every grand test, full-scale grand test has 200 MCQs with around 40 to 50 image-based questions, and there are 200 mind maps. Each mind map has around 10 high-yield facts about explanation of each MCQ. So please go and download the full-scale mock tests on the Learnograph ebook PDFs and download it, sit with your friends and 3-4 friends. You can share freely to your friends and you all sit together, discuss the question paper. That's how you'll become better. Great auricular nerve typically is thickened in conditions like leprosy. So auricular nerve thickening image and leprosy is a favorite question of the examiner. H and L variety, where do you see? Lymphocyte predominant Hodgkin's disease is what you need to remember. Reed-Steinberg cells are found in Hodgkin's. So you can see NEET PG 2018 में 2 questions पूछा गया simple lymphoma के ऊपर. So without lymphoma, leukemia, ALL, AML, CLL, CML, there is no NEET PG entrance at all. So take it as my word. Median nerve is the one which is tested for the adequacy of anesthesia. So blowout fracture of the orbit typically involves the floor of the orbit. It's called teardrop sign radiologically, blowout fracture. Chronic osteomyelitis, typically you find the sinuses. Gary's osteomyelitis, how do you identify it on radiology is the favorite area for the examiner. Similarly, what are all the causative organisms of osteomyelitis? In sickle cell disease, it is the salmonella which is the causative organism. Similarly, elderly female, high ESR, anemia, diffuse bone pains, multiple calvarial defects, multiple lytic punched out lesions in the skull, you need to remember multiple myeloma. Similarly, there is a cotton wool-like appearance with the thickening of the cortex in the skull is the feature of Paget's disease. So if you go to the learnograph.com, we have created all the image-based MCQ in every full-scale grand test. You can download the 50 full-scale grand tests that will give you adequate revision. Chronic alcohol intake lead to pancreatitis. What are the 2 major causes? Gallstone disease and alcoholism are the causes of the pancreatitis. Placenta has Wharton's jelly. Once more, how many umbilical arteries, how many umbilical veins, single umbilical artery, how will you interpret? What type of placenta? Hemochorial, discoid shaped placenta. And where is placental abnormalities like succensurate lobe means what? Right? Placenta accreta means what? Vasa previa means what? All these things are the favorite areas for the examiner. By when will feto-placental circulation get established? By day 20 to 22 is what you should remember. So how do you identify portal vein? It is the branching into the liver in the CT scan of abdomen. So once more, doctor, Cournard classification. Cournard, the French surgeon, has divided the liver into various segments. Every NEET PG, one question comes on Cournard segments. Similarly, gas in portal vein, what is the importance of it? So whenever between gallbladder and the ileum, if there is any fistula and the gallstones move from the gallbladder into the ileum and lead to ileal obstruction, then the gas in the gut will enter into the liver and biliary tree. So gas in biliary tree, gas in portal vein, you need to be very sure. Now comes rheumatoid arthritis. In rheumatoid arthritis, you have pannus. Pannus mainly contain macrophages. How do you call seropositive rheumatoid arthritis? Symmetrical involvement of the joint. Rheumatoid arthritis doesn't involve the dip. Distal interphalangeal joint is involved only by 2 types of arthritis. One is psoriatic arthritis and osteoarthritis lead to the involvement of the dip is what you need to basically remember. Very nice to see 19 online classmates. Thanks for attending the session, doctor. And just now we have another group of 8 students have downloaded the sprint session that we are now discussing. So please go to the learnograph.com. Below there is a link, and there, once you go there, you find the ebook store. There you can be able to download and be part of our WhatsApp study group, doctor. Now, special visceral efferent column. What does it include? Cranial nerve 5, that is trigeminal, specifically the mandibular branch. 7th, the facial. 9th, the glossopharyngeal. 10th, the vagus, which all innervate the muscles which are derived from the branchial arches, are the part of the special visceral efferent column is what you need to remember. Once more, the nerve columns, doctor. This is really a torture thing to remember for the NEET PG, but still you need to do it. In acute tonsillitis, why do you get a severe referred pain to the ear and throat? Because of the glossopharyngeal nerve is what you need to basically remember. So Madhu is asking, sir, one doubt, which nerve is involved in polio? In polio, basically Andrew cells are involved, doctor, and that can involve peroneal nerve. Many other, any skeletal nerve can get fundamentally involved in polio, and polio can involve bulbar, that is brainstem area leading to the respiratory depression also. Now, anteversion of the uterus is maintained by whom? Cardinal ligament is what you need to remember. So what is the histology of heart palate? Keratinized submucosa. And who is the tensor of the vocal cords? Cricothyroid is the tensor of the vocal cord. Then, where is the Simpson's fascia attached? Is one of the important MCQ in the tomorrow's NEET PG, doctor. Now, Broca's area, Wernicke's area. Wernicke is there in the temporal lobe. Broca's is in the inferior frontal gyrus is what you should remember. Now, the diaphragm and the diaphragmatic openings, even in 2018 NEET PG. So, if you go to the Sprint 7 ebook, there 2022, 2021, 2020, 2019, all these question papers are being discussed. This is the ebook 2, that is the Sprint 8 book. In this we have 2018, 17, 16 papers. Now, a BMI of 13 is considered to be lethal in men is what you need to remember. So what happens in myasthenia gravis? Acetylcholine receptors are blocked. That means the problem is postsynaptic in the neuromuscular junction. It is postsynaptic. Whereas Eaton-Lambert syndrome is presynaptic is what you need to remember. That's the reason as you are using the muscle, you become more weaker in myasthenia. Whereas as you are using the muscle, you become more stronger in case of the Eaton-Lambert. Eaton-Lambert is because of the autoantibodies against the synaptic vesicles which are containing the acetylcholine. They are sodium channels against which the antibodies are happening. So there's a problem in release the acetylcholine in Eaton-Lambert. Eaton-Lambert is presynaptic in nature is what you need to remember. So Brown-Sequard syndrome is hemisection of spinal cord. So once you take any level of the spinal cord, doctor, the spinothalamic tract already decussated. That's the reason the loss of pain is contralateral, whereas the loss of touch, that is dorsal column carried touch, and the pyramidal tract weakness, they both are ipsilateral to the side of the hemisection is what you should remember. When the V by Q is infinity, there is no exchange of oxygen and carbon dioxide. V by Q when it is infinity, that means there is ventilation but zero perfusion. V by Q of infinity typically happens whenever there is any pulmonary embolism. Once more, JVP and the waves in JVP, every NEET PG they ask a question, doctor. C wave, you have A wave, C wave, and V wave. These three are the positive waves. So when the ventricle undergoes systole, there is a point called isovolumic contraction. That means the AV valve, mitral and tricuspid are closed, and also the aortic and pulmonic valve is also closed, and a fully pregnant ventricle is undergoing contraction. That is called isovolumic contraction. During that time, what is happening? The tricuspid valve will slightly prolapse into the atria. At that time, actually, atria is relaxing. Atria is relaxing and the pressure is dropping. That is called X-descent. That time, because of this tricuspid valve prolapsing back into the atria, because of the isovolumic contraction of the ventricle, there is a slight rise in the pressure of that relaxing atria. That is called C wave, is what you need to remember. So, doctor, you need to quickly review the JVP waves. Every NEET PG exam without a question on JVP, agar hai to main naam badal dunga. Then alpha waves, EEG, REM sleep, NREM sleep, alpha waves, beta waves, theta waves. When do they happen? What are their frequencies? When will somnambulism occur? All these things you must be ready, doctor. So, alpha waves are seen during a relaxed state is what you need to basically remember. Whatever. Nice to see 23 online classmates. Excellent, doctor. So, very rapidly you need to do revision in this last moment, doctor. Every NEET PG may. One question will be there on the physiology of nephron, ascending limb of loop of Henle, descending limb of loop of Henle. Where do you find sodium potassium 2 chloride channel? What happens in proximal renal tubule? What happens in distal renal tubule? What is juxtaglomerular apparatus? What is renin-angiotensin system? How does ADH will act? What are aquaporin channels? How does aldosterone act? What is counter current mechanism? Come on, doctor. You should take hardly 15-20 minutes to do the revision of the entire nephron physiology. So, counter current mechanism involves interaction between the flow of the filtrate passing through the loop of Henle and the flow of all the blood through the vasa recta which are surrounding the loop, creating a concentration gradient that helps the reabsorption of the water and solutes, ultimately concentrating the urine is what you need to remember. Very good, doctor. 24 online classmates. Gadekar Shubham is saying, very much needed in last moment, sir. Thank you. Sure, Shubham. So, what I want to do, doctor, is I want you to be strong. How will you be strong? Remember always, tomorrow, when you are treating patient, to what extent you need to morally support a patient? You have to say, there is a light at the end of the tunnel. This is the pathophysiology of your problem. This is how we are treating you. Don't worry. To that extent, you have to strengthen. Beyond it, you should help the patient to get that moral courage to live and do the journey of the morbidity and sickness and then come out. So there are two mistakes physicians do. Either they make the patient emotionally too dependent, or they make the patient become, they are very resistant to the sensitivity of the patient. You have cancer, you are going to die. That's how few people talk. Both the things are bad. Don't make the patient become too dependent, nor at the same time don't become insensitive. So my job is similar to you as a teacher. the way I do in the morning as a physician. I want you are all now 23, 24, 25, 26. You yourself are capable of teaching others. That's how I did when I prepared for NEET PG. I mean, in my days of PG medical entrance. There are 300 students who were attending coaching, paying only 1,000 rupees, and I myself was preparing for entrance. Out of these 300 from Usmania, Gandhi, Deccan Medical College in Hyderabad, I was also preparing for entrance. First 100 we got 93 ranks, and I myself got the top rank and joined MD General Medicine. So what you need to do is, every ebook PDF, I discuss around 100 or 120 points. Beyond it, you need to sit with your classmates, friends, together. You need to master. So that is what is important. The more and more you are becoming proactive, self-sufficient, then the teacher's role should come down. That is the starting point of becoming the winner doctor. So, thank you very much, Rekha, for the wonderful feedback. You are in first year of psychiatry residency. Very good, doctor. Very good. So now, doctor, continuing our journey. Glucose is absorbed by what mechanism? Facilitated diffusion is what you should remember. Where is insulin-like growth factor is produced? It is produced in the liver. Insulin-like growth factor. Prosopagnosia, whenever the dominant parietal hemisphere is affected, prosopagnosia will be there. What is the meaning? It is difficulty of identifying the known faces. It is also called, you can say, Anjan mar rahe kyun bhai? In Hyderabad Hindi, kyun rahe tu Anjan mar rahe mujhse? बोलते अनजान मारना बोले तो जिसका चेहरा हमको मालूम है उसको पहचानना बंद कर दिया हमने, इसको कहते हैं prosopagnosia is what you need to remember. Tyrosinosis is caused by the deficiency of humoral acetoacetate hydrolase is what you need to remember. Lesch-Nyhan syndrome, self-mutilating behavior. Hypoxanthine guanine phosphoribosyl transferase HGPRT deficiency, hyperuricemia will be there. So purine pyrimidine metabolism, you need to be very sure, doctor, one MCQ short to come, right? So Suganya Indrajit is asking, sir, tell about the GLUT. So GLUT1, GLUT2, GLUT3, GLUT4, GLUT5. So only GLUT4 is insulin dependent glucose transport. Remaining GLUTs are all non-dependent on the insulin. That is at least one point you need to know, Suganya. Now, fish adore syndrome. It is caused by the deficiency of the monoxygenase 3. Galactosemia is due to galactose 1-phosphate uridyl transferase GALT deficiency. Once more, doctor, you should know essential fructosuria, fructose intolerance, hereditary fructose intolerance, types of galactosemia, which is mild, which is severe, everything you should know. So please go back and do the revision, doctor. And very nice, almost another 16 students just now have downloaded the Sprint 8 to do the revision. Cursorially, these 1000 high yield facts, right? Now, palmitic acid contains 16 carbons, is the most abundant end product of the fatty acids synthesis. Now you have DNA polymerase 1, 2, 3. 1, 2, 3 is in the prokaryotes. DNA polymerase 1 is involved in DNA repair and Okazaki fragment processing. DNA polymerase 2 is involved in DNA repair. DNA polymerase 3 in the primary synthesis of the leading and lagging strands. And eukaryotes have DNA polymerases alpha, gamma, and epsilon, where DNA polymerase alpha initiates synthesis, DNA polymerase delta and epsilon carry out lagging and leading strand synthesis respectively. And they have differences in their roles. Processivity, which has exonuclease and exonuclease activity, there are not. So there is a table on DNA polymerases. Because the DNA polymerase 1 came in NEET PG 2018, examiner के क्वेश्चन बैंक में बैठा हुआ है DNA polymerase. Chaperones are the proteins which will help in the protein folding. Fishy odor is due to deficiency of riboflavin in the diet. Take it as my word, doctor. Every NEET PG exam, at least 2 to 3 MCQs vitamins के ऊपर आएगा. Without that, there is no question paper. So like that, you can predict what is going to be the question paper. Cystinuria affects the 4 amino acids absorption. Cysteine, ornithine, lysine, arginine, cola. Where is the absorption affected? Both in the kidneys and intestines. Fibrinopeptide A, fibrinopeptide B are acidic because of which amino acid? Because of the glutamate and aspartate. So, amino acid classification, which are neutral, which are acidic, which are ketogenic, which are glucogenic, which are both keto and glucogenic, which are exclusively ketogenic. All the amino acid का धंधा मालूम होना है कल के NEET PG को survive होना बोले तो. So that is how you need to go back. You need to take the help of the sprint 7, 8, 9, 10, 11, 12, 13, 14, 15, 16. The total 10 ebooks. Each ebook is 300 rupees. This will make 10,000 questions, 2013 to 23 NEET PG question bank converted into single liner along with the topic, and that makes you and helps you to do a cursorial revision, doctor. Now, what in Finkel-D cells, where do you see in measles? CD59 is a marker of PNH. Complement component C3b acts like a opsonin. That means examiner के मन में PNH है. Examiner के मन में complement pathway का, which is enephalotoxin, which is opsonin. You have to be very sure. Once more, von Willebrand disease, Glanzmann's thrombasthenia, Bernard-Solier syndrome, bhajan karo, bhajan karo, bhajan karo, yaro. This is the only way you can become the winner. So Bernard-Solier is because the GP1B, whereas Glanzmann's thrombasthenia, GP2B3A. So you need to be very sure what is the difference between these various platelet disorders. Cowden syndrome is associated with P10 mutation. Once more, go back and check familial edematous polyposis. What is Gordon syndrome? What is hereditary polyposis colon cancer, where you find the mismatch repair? What is Cowden syndrome? Exam hall mein suddenly it should not appear like a surprise, doctor. Everything is predictable based upon who is the king of all previous year's questions, PYQs, right? So they say no, whether you go to Hollywood movie or whether you look at the various books, sex always sells. So also PYQs always sell, right? जो PYQ नहीं एक कनीसम at least 1 round अगर revision नहीं किया, minimum guarantee 10,000 MCQs का, PYQs का, sprint 7 to sprint 16, 10 ebooks को एक मर्तबा अगर आप राउंड नहीं मारे तो मुश्किल ही नहीं नामुमकिन बन जाएगा. एक राउंड मारे तो even if your preparation was only for 100 hours also, still there is a chance of you hitting the jackpot. All right. So powerful is PYQs, right, doctor? Sex sells. If you are having a very romantic movie, never romantic movies fail, right? Unless it's, I know, I don't want to say about some directors. So PYQs are also such an essential basic ingredient you need to master, doctor. In shock, the kidney, what will happen? There is an increased afferent arteriolar resistance, because in shock you have hypovolemia. Hypovolemia decreases the renal plasma flow. Renal plasma flow decreases the GFR. unless the afferent arterioles undergo the constriction, is what you need to remember. So dopamine, why do we give in a shock patient? To improve the renal plasma flow. Because very intense afferent arterial resistance in hypovolemic shock, what will it lead to? It lead to acute tubular necrosis. That's the reason to avoid this afferent arteriolar resistance and constriction from happening. We give dopamine, which will increase the renal plasma flow and maintains the adequate GFR and prevent the increase of the afferent arteriolar resistance, is what you need to basically remember. Humera Mustiba says, please do sprint on images also. Definitely, doctor. In fact, you can go to our 50 full-scale grand test PDFs. You can download, and if you download the PDFs, then every full-scale grand test has 30 to 40 image-based questions. So all 50 milaye to at least 2,000 image-based questions, and there are about 10 points on each of that question is already there, doctor. So please remember that. So Humera and everybody, please give a call to 9000-868-356, right? So what you can do is you can call this number. If you are buying all the 50 full-scale mock test PDF ebooks, they will give a very special discounted price for all of you. And also there is a number of one of the manager, Mary, I'm leaving below. You can even WhatsApp her or call her, and then she will also help you to get the discounted price for the subscription, doctor, right? So, yes. So now, trolley. So once more, trolley and acute transfusion reaction. That is the anaphylactic reaction of blood transfusion. What are the differences? You need to be very sure. Typically, within 6 hours, जो reaction होता है, वो होता है trolley. Now, doctor, gastric adenocarcinoma is an epithelial tumor of the stomach. Color blindness is X-linked. Stellate granuloma you see in cat scratch disease. Then you should be very sure on things like Schauman's bodies, everything you need to be very, very sure, doctor. Now, anaplasia versus metaplasia. What is the difference? Metaplasia means one mature cell type becoming another mature cell. Dysplasia means deranged growth. It is precancerous dysplasia. Anaplasia means lack of differentiation को कहते हैं anaplasia. A prolactin level of 200 nanogram per ml suggests prolactinoma, is what you should remember. Laxative abuse, if the patient is on, then what type of renal stones form? Ammonium urate renal stones is what you need to remember, doctor. All these things we come across in and day out clinical practice. In sickle cell anemia, what is one of the important complications? Because the vaso-occlusiveness, dactylitis can develop. Dactylitis. And where does amphotericin B basically function? It acts on the cell wall, is what you should remember. So all antifungals, fluconazole, echinocandins, amphotericin B, how do they function? What is their mechanism of action? You need to be very, very, very sure when you go for the tomorrow's NEET PG. Emtricitabine, it has an anti-hepatitis activity against the hepatitis virus and also anti-retroviral activity. And remember, doctor, every NEET PG, make a mark, make a note, right? Every NEET PG, one MCQ will be there on antiretroviral drugs. One MCQ will be there on antiviral drugs. acyclovir, foscarnet, how do they basically work? What is the cause of acyclovir resistance? You have to be very sure. So, whenever rheumatic chorea is very resistant, what is the anti-epileptic of choice? Valproate is the anti-epileptic of choice, is what you need to remember. So, Humera is saying, sir, humble request, only 10 days left, no time to do all mocks now. Please do one sprint on images. Sure, definitely. Let's do one of the days, doctor. Definitely. For Humera, kuch bhi karenge hum. Now, at pKa equal to pH, it's called isoelectric pH. The concentration of the drug is 50% ionic and 50% non-ionic. So what is the physiological dose of hydrocortisone, doctor? 10 mg per kg per day. So once more, you should remember, hydrocortisone versus prednisolone versus dexamethasone, right? And methylprednisolone. How do they differ in their strengths? 1:10, 1:40, 1:4. So you need to be very sure on these different types of steroids. In acute gout, how does colchicine work? Colchicine inhibits leukocytes, lymphocytes, and act like a microtubular inhibitor. Now comes the practice clinical point, favorite question of the examiner. Allopurinol, never give in acute gout. Allopurinol, never give in acute gout. It should only be given in chronic gout, prophylactically. Please don't forget, doctor. Oh, my wonderful doctor. Gout drugs के ऊपर 1 MCQ अगर नहीं आए तो मैं अपने पद को इस्तीफा देता हूं. ठीक है? So basiliximab typically is interleukin-2 receptor antagonist. Once more, doctor, there is a list of monoclonal antibodies. Please don't forget. And this list of monoclonal antibodies say at least one question, guarantee, paper out. Then pyrenzipine is used for gastric ulcer. Risperidone, among the antipsychotic drugs, typically will decrease the dopamine. Decreased dopamine will remove the inhibition on prolactin. That's the reason there is an increased prolactin secretion because of these antipsychotics, which are all dopamine antagonists, is what you need to remember, doctor. Metirapone is glucocorticoid synthesis inhibitor. Prasugrel, how does it work? P2Y purinergic receptor blocker. Prasugrel. So once more, since Prasugrel came in 2018, NEET PG, you know how important it is. Now, there are a list of drugs that lead to prolongation of the QT interval. So what is the normal corrected QT interval, doctor? It is typically 420 milliseconds. When do you call prolonged? If it is more than 600 milliseconds, quinidine, procainamide, they all prolong the QT. Any prolonged QT lead to polymorphic ventricular tachycardia. Polymorphic ventricular tachycardia, which is called Torsades de Pointes, is what you need to remember. Sacubitril valsartan. Sacubitril valsartan. What is this very popular brand of this drug, doctor? It is called Vimada. Vimada किसको देते? Congestive heart failure में Vimada 25, Vimada 50 दिए तो patient बहुत आराम से CHF को tolerate करेगा. So how does sacubitril act? It is a neutral endopeptidase inhibitor. If you are not very sure about this molecule, right, you need to go back to the whatever the notes you are studying. It doesn't matter. All notes ultimately, which coaching center, plan A, plan B, or whichever plan. They will all give the same good essential material for you, doctor. It doesn't matter which notes that you read. But are you able to consume it quickly, do revision? That is important. Niacin therapy is contraindicated in diabetes because it increases the blood sugar level and it leads to hyperglycemia. So all the hypolipidemic drugs, what is their drug interactions, what are their adverse effects, we should read, because NEET PG 2018 Bible में लिखा है ये क्या है? स्प्रिंट वाला नीट पीजी बाइबल है ये। इसमें जो भी होता है वो फिर आता है। PYQ you have to master it like गीता, बाइबल, कुरान। वैसे प्रीवियस ईयर क्वेश्चंस से ही आपका स्टार्टिंग पॉइंट हो रहा है कभी भी प्रिपरेशन, राइट? बहुत लोग बोलते हैं मैं पूरा प्रिपरेशन खत्म करने के बाद, मैं उस्ताद बनने के बाद, मैं एक जापानीज सुमो बनने के बाद मैं प्रीवियस क्वेश्चंस करता हूं। क्या फायदा है? आप जिंदगी में कभी भी 10 बार हैरिसन पढ़े तो will you become a master? Nothing. 19, 20 books are there waiting for you. So that is the reason, start your preparation always. At least I'm telling to the juniors who are going for 2025. Start your preparation with this sprint 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, where single liner PYQs are consolidated into single liners with topic wise analysis for you to know what to focus on. That is important, doctor. If you know that, you are the master. Right? Now, endothelin acts on cyclic AMP receptors. So bosentan like drugs, typically what do? They act on the endothelin. So endothelin acts on cyclic AMP receptors. अगर आप yesterday sprint 7 ebook का डिस्कशन अटेंड हुआ हो तो इनोसिटॉल ट्राइफॉस्फेट डाइएसाइल ग्लिसरॉल के बारे में देयर वर क्वेश्चंस। दैट मींस सेकेंडरी मैसेंजर्स इज द फेवरेट एरिया फॉर एग्जामिनर डॉक्टर, डाउट ही नहीं है। Tijanidin is a centrally acting alpha-2 agonist which is used as a muscle relaxant. Apixaban is a direct factor 10A inhibitor. Once more, oral anticoagulants, direct thrombin inhibitors. You need to be very sure on the topic of anticoagulants. One MCQ guarantee है भाई, मुरली भरद्वाज का 100% स्टैंप डाल के मैं बता रहा हूं आपको, डाउट ही नहीं है। Anaerobes, if you take, they are intrinsically resistant to aminoglycosides. Please remember, aminoglycosides are not effective on anaerobes. This used to be one of the favorite ward round question of our chief. He used to say, is metronidazole useful? Yes, sir. It is useful for anaerobes. Is the clindamycin useful? Yes, sir. And are the aminoglycosides useful for anaerobes? You should say, no, sir. Then only you will move forward in the ward rounds. So that is how important. Senna, among the laxatives, typically causes melanosis coli. Beta-lactam antibiotics with beta-lactamase inhibitors are the choice for catheter-related UTI and pneumonia in the bedridden patients. So, typically, silastine, clavulanic acid, all these things are added in order to improve the action, right? So, what is a very common drug we administer to pneumonia and UTI? Cefoperazone plus sulbactam is the one which we basically administer, which is like a miraculous drug in the intensive care. Mycoplasma doesn't have a cell wall. That's the reason cephalosporins like ceftriaxone or penicillins, they cannot act on mycoplasma. 40% burns in a 50 kg with second degree burns. We need to give 4 liters of ringer lactate in the first 8 hours. So you should know the Parkland formula very, very, very clearly. Now, who is a posthumous child, doctor, who is born after the death of the biological father is called the posthumous child. McNaughton's rule, section 84. So there are about 8 to 10 sections which frequently asked in the NEET PG. हर एक कोचिंग मटेरियल में वो अवेलेबल होता है, मगर लास्ट मोमेंट रिवीजन करना क्योंकि 2018 में सेक्शन आ गया। Bluish discoloration of the gastric mucosa, emitol sodium poisoning. So all this toxicology, postmortem appearance is very important. Muscle pain and nephropathy are the part of Arsenic poisoning. Arsenic poisoning also, you should remember, raindrop pigmentation. Raindrop pigmentation. You need to be very sure. Varabha, nice to see. Quarter century. Thank you for attending, doctor. My next 10 days, even if I am very, very busy in the morning with the patients, intensive care patients, patient attendant saying, sir, will my daddy will survive this type 2 respiratory failure. Another patient saying, oh, there is a metastasis, PET scan is positive, what to do? So the whole morning mera time chale jayega. Never we cure, sometimes we palliate, but always we can offer our shoulder for a sobbing and crying patient's attendant and comfort. Remember, that's a prayer I always, my grandfather when I was joining in medical college said, never we cure, hum cure deta hi nahi. Sometimes we palliate, thoda dard kam kar sakte, but always, what can you do, doctor? You can comfort, offer your shoulder for a sobbing patient. So that is one prayer with which we should always go to the hospital. So also, you are born with a purpose, doctor. Remember that. Face the war and battle with your head held high, where the knowledge leads you into the vision and light, not into the deep lanes of the darkness and the valleys of pessimism. You need to be an incurable optimist. You need to say, अरे भाई 25 लाख कोशिश करने के बाद टॉप 5,000 10,000 रैंक्स में हुए तो नीट में डॉक्टर का सीट मिलता है. कुछ लोग they went all the way to Russia, China, Ukraine, cold areas and came back. So you are born with a purpose, doctor, remember. So post-graduation is only one step ahead. So focus ke saath revision karo. There is no very big ant hill that you need to chadne ka zarurat nahi hai. You need to know 10,000 PYQs. You need to have your own analysis about where to concentrate, and simple notes will help you last moment revision ke liye. More than enough, doctor, for you to become the winner. I am there with you. Another 3-4 friends ko ke saath padho. I am already your classmate, roommate, benchmate, tablemate, to be with you every day, to study along with you. But what you need to become a topper, becoming topper is never a solo effort. It is a team play, like IPL match. So 3-4 friends बैठे तो किसी को डिप्रेशन है तो दूसरे उनको जगाते, और आपको रिवीजन करना है तो उसको एक स्प्रिंट पीडीएफ दे दो. Only one of you buy, give it to remaining 3-4 free, no problem. So you ask, okay boss, you ask the questions, fatafat you try to answer. That's how you need to prepare. Very positive mind, doctor. Very good. Yes. Now, brain is the first organ to putrefy. What is Locard? Locard's principle of exchange in the forensic medicine. Basio-occiput fuses with basis sphenoid between the ages 18 to 22. Is a mummy odor? Mummified body is odorless. Whenever cadmium poisoning is there, it will go and affect the proximal tubule and lead to development of proteinuria. Under the Factory Act, children under how much age cannot be employed, doctor? Under 14 years cannot be employed. So once more, ESI Act, Factory Act, how much space workers को provide करना है, कितने दिन leave देना है, how much should be the compensated leave, how much is the contribution of employer and employee. Even if you want to be cardiothoracic surgeon, you need to know all this shit before clearing the NEET PG. Be very sure. Burkholderia cepacia is the drug which is resistant to sifotidine. Shingles is caused by varicella zoster virus. Childhood में chicken pox is adulthood में Varicella zoster when it undergo reactivation when the person is immunocompromised. Urea breath test typically is done for H. pylori. Hyperacute, acute and chronic rejection. Hyperacute is because of preformed antibodies. It occurs within minutes. Acute rejection and chronic rejection. So they are the ones which are cell mediated is what you need to know. And remember, graft versus host disease. Yesterday, ebook sprint 7 में हमने 2022 पेपर में देखा ग्राफ्ट वर्सेस होस्ट डिसीज. इसका मतलब क्या है? हर एक नीट पीजी में एग्जामिनर विल आस्क ए क्वेश्चन ऑन द ट्रांसप्लांट, व्हाट ड्रग्स यू यूज टू प्रिवेंट द ट्रांसप्लांट रिजेक्शन, एवरीथिंग यू शुड बी श्योर. Australian antigen is what? Hepatitis B surface antigen is what you need to remember. Once more, NEET PG's favorite question. Serology of the hepatitis B. When do you call chronic carrier? When do you call as the one which is having a very replicative virus? Whenever there is envelope antigen positive. How do you identify the window period in the serology? Everything you should be sure. Aspergillus is associated with orbital cellulitis in patients who have diabetic ketoacidosis. What is the test for toxoplasmosis, doc? Sabine Feldman's dye test is the question asked in NEET PG 2018. Acute hemorrhagic conjunctivitis. This can be a potential image-based question. It is caused by the enterovirus type 70. Echinococcus granulosus. Dog is a very important component in the Echinococcus granulosus life cycle. So amoebiasis, hydatid cyst, all these things are favorite areas for examiner. NRO which cause multiple abscesses with a discharging sinus with sulfur granules. Where do you see that? Actinomycetes. Whole blood is used as a sample for the IGRA test. So I leave an imagination for you. What is meant by IGRA test? And try to do a quick look at it. It is not a very recurring question, but still. E. coli is the organism most commonly responsible for bacterial prostatitis. Pseudomonas aeruginosa release the histamine and causes the scombroid fish poisoning is what you need to remember. Anton von Leeuwenhoek is the father of microbiology. So you should know little general knowledge also in NEET PG 2018. Cutaneous larva migrans is caused by Ancylostoma brasiliense. CMV infection is the most common after kidney transplant because of the transplant immunosuppression. If the incidence of the disease is 4, duration is 2, always incidence into duration is equal to prevalence. Bakwas question. Simple question, right? Cytotoxic and expired drugs, how do you dispose, doctor? Landfill. Abhi mil gaya. One question on yellow bag, black bag, green bag, red bag, classification of the waste management, disposal. Even if you want to be cardiologist, you should all be sure about the shit for the NEET PG in the community medicine. For NRR to be 1, net reproduction rate, CPR, couple protection rate should be 60% is what you need to basically remember. Very good, doctor. Another group of 12 students just now downloaded the both 7 and 8 sprint ebooks from the learnograph.com. So don't forget to like this video. Write your comments below video, very important. That's how YouTube will try to populate it virally. So please make it viral. Also share this video link in all your Instagram, WhatsApp, Telegram, wherever the group, right? Now, NICSHI is the new revised National Tuberculosis Program software to monitor the TB control program. Now, what is the study unit in an ecological study? Once more, case control, cohort study, you need to be very sure. The study unit of an ecological study is the population itself is what you need to remember. So if the sensitivity of a test is 90, Sensitivity, what is the sensitivity of a test where 90 are positive out of 100 confirmed cases? So sensitivity test true positives, specificity test true negatives is what you need to remember. Rifampicin is used for the mass chemoprophylaxis for the meningococcal meningitis. It is the drug of choice. So what you should do is you should sit with a friend. Tell him, भाई तुम मुझे questions पूछो sprint book से, तो वो क्या इसको instantly fill up the blank के format में पूछेगा आपको. Mass chemoprophylaxis for meningococcal meningitis क्या इस्तेमाल करते हो रे? Rifampicin. बहुत अच्छी बात है. What is the active form in chlorination? Hypochlorous acid. Kala Azar is found in all endemic areas except which state ray? Assam. Risk among exposed to risk among non-exposed is called as the relative risk, or otherwise called risk ratio, is what you need to remember. Whereas the risk difference is the name given for the attributable risk. Pasteurization कितने टेम्परेचर में करते हो रे? 63 degrees Celsius for 30 minutes. भजन 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 करना है डॉक्टर. You don't need big coaching programs, apps and all that. क्या चाहिए आपको? भजन करने के लिए 2-3 साथी मिलना है. साथियों के साथ बैठ के डॉक्टर मुरली भारद्वाज का स्प्रिंट ई बुक को डाउनलोड करके एक खरीद लो, आप 4 शेयर कर लो, नो प्रॉब्लम. You know, even in our MBBS days we used to do Xerox, right? We never used to buy the regular books. One बकरा मिलता है, उसको हम बोलते हैं अरे यार तू इतना इंटेलिजेंट है रे, तू हैरिसन रे, वो रे ये रे. That fellow will go innocently buy the Harrison, and we all used to study that fellow's Harrison and give him the notes on the Davidson to that fellow to read them. All right, I'm back, doctor. Sorry. Home means internet is never predictable. So, yes. Am I audible? Can you please punch am I visible and audible for all of you? Can you please punch? Can you please punch? Am I audible and visible, doctor, for all of you? Yes. Loud and clear. Thank you, Prakash. Anupam, yes. I'm about to conclude, in fact. So, hardness. Water hardness is a favorite question of the examiner. Yes, doctor. So, water hardness is a favorite question. Temporary hardness is dissolved bicarbonates, calcium bicarbonate and magnesium bicarbonate. Whereas permanent hardness is caused by sulfate or chloride of the calcium and magnesium is what you need to remember. So once more, what is direct transmission, indirect transmission, simple questions, but favorite questions of the examiner. So all these paranasal sinus radiological views is a favorite question, doctor. So Waters view is for the maxillary sinus. There are another 4 to 5 views. If you are not sure, just go back and do the revision. Tracheostomy is indicated whenever there is any foreign bodies obstructing the airway. Once more, in the same exam 2018, Calwell's view is used for frontal sinus. Astigmatism in an emmetropic eye of an elderly person typically it contributes to +3 diopters of refractory error. 100-day glaucoma, किसका नाम है? Central retinal vein occlusion. Where do you see rot spots, doctor? They can be seen in acute leukemia. The yoke muscle of the right lateral rectus is the left medial rectus. What are yoke muscles? The two muscles contributing to the conjugate movement of the eye. अगर आप लेफ्ट देख रहे हैं तो रीडिंग रूम में बैठ के किसी हैंडसम यंग मैन इज वॉकिंग बिफोर यू, आपका लेफ्ट आई वो ग्रीक प्रिंस को देख रहे हैं तो आपका राइट आई एडक्ट होगा, लेफ्ट आई एबडक्ट हुए तो इसको कहते हैं योक मसल्स. वन एबडक्ट्स, अदर एडक्ट्स. एंड व्हाट इज इंटरन्यूक्लियर ऑप्थेल्मोप्लेजिया? Typically, when abduction is happening in one eye, the other eye is unable to adduct, and there is an adductor lag, and that typically lead to nystagmus in that eye where there is a adductor lag, and it is because of the medial longitudinal fasciculus which connects the third and the sixth cranial nerves को connect करने वाले medial longitudinal fasciculus in the brainstem में अगर demyelination हो गया because of the multiple sclerosis like condition, you get the internuclear ophthalmoplegia. Severe conjunctivitis is the feature of Neisseria. Myopic astigmatism prescription क्या होता है? Plano lens of minus power. PGE2 is an endogenous pyrogen, different prostaglandins you should know. Similarly, Bartter syndrome, Liddleman syndrome, Gitelman syndrome, Gordon syndrome. What is the difference between them? Favorite question. Every NEET PG एक question आता है. Bartter, Gitelman, Liddle, Gordon. Today only you should go back and do the revision. Bartter में there's a defect in the thick ascending limb of loop of Henle. Bartter is like taking a loop diuretic forever in your life. Because loop diuretics also what do they do? They go and inhibit the 2-sodium potassium chloride. Same thing happens in Bartter where 2-sodium potassium chloride stopped working is what you need to remember. Automatic implantable cardiovascular defibrillator implantation. There is an indication, Brugada syndrome, ventricular fibrillation, acute coronary syndrome with a low EF, in all these there can be a cardiac arrest. That's the reason you need to put automatic implantable cardioverter defibrillator. Once more, doctor. Brugada syndrome is one topic examiner regularly will ask in the tomorrow's NEET PG. So what are the criteria of neurofibromatosis type 1, doctor? Brain tumor, pseudoarthrosis, cephalate spots, but not acoustic neuromas. Bilateral acoustic neuromas are the part of neurofibromatosis too, and they're not the part of the criteria of diagnosis. Chronic gastric ulcer. The most common site is in pyloric antrum. You need to be very sure. How much time is the window period between acquiring HIV and manifestation of AIDS? 10 years is the window period. Where do you do Heller's myotomy, doctor? It is done in achalasia cardia. So in taco subbo cardiomyopathy, you need to be very, very sure about. There is a myocardial stunning pattern on ECG. ST segment elevation, T wave inversion. But looking at the ST elevation, if you go and do angiogram will not show any coronary artery obstruction. So myocardial stunning pattern of ST segment elevation and T wave inversion in the absence of coronary artery obstruction is classical of tacosubbo-cardiomyopathy. It is basically a Japanese spot which looks like takosubbo. You need to go back to your material. Brugada syndrome, takosubbo, cardiomyopathy. 4-5 points, एक मर्तबा revision करो or be prepared in the tomorrow's NEET PG instead of keeping a complete innocent face to the examiner. So this is how we discussed almost 155 points, doctor, in no time. So you need to do your last moment revision. You should start your preparation with PYQs. You should end your preparation before becoming topper with PYQs. In the middle, you do anything else. So thank you so much, Madhuri, Anupam, Prakash, Mitchu. I like to see you every day, right? And if I get time in the morning before going to hospital एक बार गए तो life control में नहीं रहता. So before going to hospital, I'll try to take one more extra session in the morning also, right? So morning, evening भी पढ़ेंगे next 10 days. गर्मा गर्म, why not, right? So be in that positive spirit every day. That is important, doctor. The role of a teacher is not to teach you. The role of the teacher is to inspire you, to infuse that incurable optimism in you. And Dr. Murali Bharadwaj is very good in that. Past 25 years, I had chance to mentor 3 lakh doctors like you. A lot of them are now toppers. Every hospital I go, my students are there. So you're also going to become my colleagues one day. Good night, and we'll all see you tomorrow.